Um, I've been following this story for the last week and certainly the debate here tonight, and I'm struggling to figure out who exactly is in charge because you know, is the management that run the hospital, or is what input government actually have? The Taoiseach made his position quite clear earlier today in relation to the UHL. He said the HSE is directly responsible for running and the management of hospitals, and the government won't interfere in that. And I'm struggling to find out why Navan is different. The HSE announced early last week that the emergency department in our Ladies' Hospital, Navan, would be closed to critically ill patients from September. And within minutes, senior government ministers were stating the opposite, that it hadn't been sanctioned by government and it would not be closed. We're in the very unfortunate situation where the clinical director in Navan Hospital, Jerry McEntee, has had to go on a media defensive against the words of the Taoiseach, the Minister for Justice, and indeed yourself. The closure of Navan Emergency Department was decided by Fine Gael government and a Fine Gael Minister for Health in 2013 in the smaller hospital framework document. That document provided 9 smaller hospitals, changing from Model 3 to Model 2, with the closure of their EDs as a consequence of the shift. When every party in this House came together in an agreement on Sláintecare, it was not only a commitment to universal healthcare free at the point of use, it was a commitment to an evidence-based healthcare system. To end a tradition of using healthcare as a political football, where resources were often distributed in accordance with the constituencies of ministers of the day, rather than where the need was most acute. The situation in Navan Emergency Department has found itself in is bleak, to say the least. The clinical director could not have been clearer in his assessment, stating that the emergency department is a risk to the lives of critically ill patients and that they're not afforded the best chances of survival. When family members or an ambulance service bring critically ill patients to Navan, they do so in the belief that the emergency department will deliver life-saving care, and that care is needed. And why wouldn't they believe so? That's the absolute least we should expect from an emergency department, that they would have the skills and the resources to do the absolute best they can to save someone's life. We expect the same standard of care in every emergency department in the state, whether it's Beaumont or Navan. But that isn't a reality for the people of Meath. Emergency department nursing staff, physicians, surgeons, anaesthetists, junior doctors, and every HSE official connected to the hospital have all raised the concern that the emergency department in Our Lady's Hospital is absolutely unsafe. We cannot ignore the voices of the medical professions who are working day and night to care for the people of Meath, and who are making it very clear that they do not feel they can continue to provide emergency care to critically ill patients. Local hospitals are incredibly vital components of our communities. Of course, they provide employment, but more importantly, they provide a sense of security. Living within a short distance of an emergency department is comforting, especially for older people or those with additional healthcare needs, or indeed people who want to ensure that they can visit so that they can have some oversight of a family member. So it's absolutely understandable why local communities want to retain them and are anxious about the potential impact on their access to emergency care when a closure is imminent. The logic behind the closure of small emergency departments is well backed by evidence. Small emergency departments just aren't viable, not in terms of cost, but in terms of patient safety. The critical mass isn't there to ensure staff are trained properly. There are, I believe, only 64 beds in Navan, with around 300 beds generally needed for a critical mass that would allow for specialisation. The emergency department in Navan is already bypassed by ambulances carrying heart attack and stroke victims, because it is known by medical professions that it's safer to bring them to Drogheda. But for family members who are transporting a loved one who has just suffered a stroke, they of course will go straight to Navan. And it's absolutely unacceptable that these patients would receive a lower level of care just because their family isn't in the know about the internal the internal way the health service is run in that particular hospital. Cover in the emergency department is not provided by consultants, but by agency registrars who aren't specialists in emergency medicine. The hospital isn't accredited for junior doctors, so they can't attract the staff they need. And as the smallest ICU in the country, the staff that are there don't get the necessary experience to be properly trained on the job in the way that the staff would be or are in busier hospitals. The writing has been on the wall for the emergency department in Navan since 2009, with official commitments given in 2013. That's 9 years the government and the HSE had to plan for an orderly transfer of critical care from Navan to Our Lady of Lourdes Hospital, if that was what the plan was. Why have we once again wasted that time, years kicking the can down the road, delaying important decisions, until we get to a point of crisis? We don't appear to do planning in this country. We just wait till the crisis happens and then try and work back from it. This could have and should have been an orderly transition. The necessary resources should have been in place and drawn out well in advance of the transfer. An increase in ambulance cover should have been provided, and fundamentally the local community should have been informed every step of the way. Their concerns should have been addressed. There should have been constant communication to the local community, assuring them their access to emergency health care would in fact be improved, not worsened. But none of that has happened. This is an exercise in the failure of planning and preparation, and it's a pattern that is well evident at this point. The plan for transitioning smaller hospitals from Model 3 to Model 2 has always been very clear. The larger hospitals would receive more resources and training to become centres of excellence with larger catchment areas and more specialisation. It's very difficult. We keep on, I know we've got a census of population that has just been taken up, and we talk about that as a basis for planning our services. You even roll out advertisements about that. And when you look at the like of Meath, it has a population in 2016 just short of 200,000 and will increase significantly as it will be revealed in the census. And it's very difficult to see, and indeed Louth is a growing area, as is the Fingal area, which is adjacent to it. It's very difficult to see how, if you're talking about using populations, the demographics and the statistics and the census to design services, it's very difficult to see, what kind of thought has gone into this whole catchment. While the new Model 2 hospitals would in fact become busier than ever, providing a range of care from minor injury units, step-down rehabilitative care, scanning centres, labs, etc. The latter has been largely successful, the former not so much. The HSE tends to give a lot of promises in relation to the resourcing of emergency departments and the standards which will be achieved, and they often don't follow through on that, and people don't believe them, and that's part of the problem. Is it any wonder people are opposing the closure of the emergency department, as inadequate as it is, when the HSE's track record is so poor? We only need to look at the impact on the closure of Loughlinstown had on St Vincent's at the time, or what the closure of Ennis and Nina had on the University Hospital Limerick, that's been mentioned earlier in this debate, which was subject to, as we know, a damning HICWA report last week. The problems in overcrowding in Limerick can be tracked back to the closure of those two EDs in Nina and Ennis. Meath has one of the, as I say, the fastest growing populations in the country. It's very difficult to see how that has even been factored in. The average wait time in Our Lady of Lourdes Hospital in Drogheda is already reported to be 14 hours, while the HSE are predicting very low numbers of patients transferred from Navan to Drogheda. That waiting time is already too high, and the population in this larger catchment area is only going to grow and grow. It's absolutely essential that the same problems faced by UHL are not replicated in Drogheda, and medical staff in Drogheda are already quite concerned about their capacity to take patients, and again we've heard that this evening. The concerns of the medical professions in Navan also need to be centred in this debate. They know the situation on the ground.
Thank you,
and so, okay, sorry, I've gone over time. Thank you.
Thank you, Deputy.